Gentlemen, if you're a man with pelvic tension and you happen to ride bikes regularly, you might not just be imagining things. If you get numbness, tingling, testicular discomfort, erectile changes, or in other words, pelvic floor tension, it might be your body telling you that something needs to change. So today, I'm answering a question I hear a lot as a men's pelvic floor physiotherapist. Does cycling cause pelvic pain? And more importantly, how should you fit your bike to reduce unnecessary pressure on the pelvic floor, pudendal nerve, and perineum? First things first, cycling is not automatically bad for your pelvic floor. In fact, it can be an amazing form of cardiovascular exercise. And as a physiotherapist, I'm all for any kinds of exercise that gets people excited to actually do it. But cycling can contribute to some symptoms in some riders, especially when there's prolonged pressure through the perineum. Before we dive deep into the research, the key point is this. Cycling doesn't cause pelvic pain in everyone, but it can be a trigger or aggravating factor for some people. Let's jump into this. Research on cyclists has linked long rides and perineal compression with genital numbness, erectile symptoms, and nerve type symptoms. For example, Anderson and Bovin's study of long-distance amateur cyclists found that 22% of men reported symptoms in the pudendal or cavernous nerve distribution along the pelvic floor, and most commonly, penile numbness or reduced sensation. In some cases, symptoms lasted longer than a week, and the authors noted that impotence and genital numbness may be more common in long-distance cycling than previously recognized. When you sit on a bike saddle, pressure can go through the sit bones, but it can also shift forwards into the perineum. That area contains important nerves and blood vessels, including branches of the pudendal nerve and blood supply to the penis. In another study, researchers studied cyclists and found that penile oxygen perfusion decreased while sitting on the saddle, supporting the idea that perineal compression can affect blood flow during cycling. Their recommendations included keeping the saddle level or slightly nose down, avoiding a fully extended knee at the bottom of the pedal stroke, keeping a slight bend in the knee, and changing body positions regularly during rides. So if you are getting numbness, tingling, burning, erectile changes, or pelvic pain, don't ignore it. Numbness is not a badge of honor. It is usually a sign that something is being compressed or irritated. The honest answer is, cycling can contribute to pelvic pain, but it's usually not the only cause. Pelvic pain is highly multifactorial, with all kinds of variables that may influence the pain. Nerve sensitivity, training load, stress, hip mobility, low back mechanics, the pressure on the saddle, and how long you stay in one position. All of these can be triggers. That being said, let's get into some practical tips that you can use today to minimize your pelvic floor tension. Tip number 1. Check your saddle height. Your legs should not be completely locked out at the bottom of the pedal stroke. You want a slight bend in the knee. If the saddle is too high, you may rock side to side through the pelvis, which can increase friction, pressure, and tension through the pelvic floor. If it's too low, you may overload the hips and knees and create a cramped riding position. Neither are ideal. Tip number 2. Keep the saddle of the seat slightly nose down. A saddle that points upwards can increase pressure into the perineum. Researchers recommended that the saddle should be level with or with the nose pointed slightly downwards. But be careful, too much downward tilt can make you slide forwards, which may cause you to brace through your arms, grip harder, and tense your pelvic floor. Tip number 3. Raise your handlebars if you are getting numbness. If your handlebars are much lower than your saddle, you may be pushed into a more aggressive forward position. That can shift more pressure towards the front of the saddle and the perineum. A more upright position can help shift pressure back towards the sit bones or the ischial tuberosities rather than the front of the pelvic floor or perineum. So if you're dealing with pelvic symptoms, don't assume that a more aggressive race position is better. For many people, a slightly more upright setup is more pelvic floor friendly. Tip number 4. Stand up regularly. Every 10 minutes or so, change your position. Stand on the pedals briefly, shift your weight, or come out of the saddle. This helps reduce sustained compression through the perineum. Remember, standing more than 20% of the time while cycling was associated with reduced odds of genital numbness. Tip number 5. Choose the right saddle for your anatomy. There is no perfect saddle for everyone. Some people do better with a cutout saddle, a wider saddle, or a shorter nose or a noseless design altogether. The goal is to support the sit bones while reducing pressure through the perineum. If your saddle is too narrow, your sit bones may not be supported well, causing more pressure in the middle. If it's too soft, you might actually sink into it and actually increase compression. Firmer doesn't always mean worse, and softer doesn't always mean safer. Tip number 6. Don't rely on padded shorts. Padded shorts can help with comfort, but they do not automatically fix pressure or bike fit problems. Interestingly, In one study, never wearing padded shorts was associated with lower odds of genital numbness and saddle sores. That doesn't mean padded shorts are bad for everyone, but it does suggest that padding alone isn't the solution. And if you need thick padding just to tolerate your saddle, the saddle or bike fit may be the real issue. Tip number 7. Reduce training intensity or volume if symptoms appear. If numbness, pain, or erectile changes show up after increasing your mileage, adding hills, or doing more indoor cycling, that's useful information. Don't push through genital numbness. Back off, adjust the setup, and let irritated tissues calm down. Tip number 8. Watch for pelvic floor guarding. Some cyclists respond to discomfort by gripping, bracing, clenching the glutes, holding the breath, or tightening the pelvic floor. Over time, this can become a pattern. A helpful cue when riding is you want to ask yourself, can I soften my belly, breathe into my ribs, relax my jaw, and let my pelvic floor drop? You don't need to be completely floppy on the bike, but you also don't want to ride for hours in a guarded, clenched position. If you have temporary, mild discomfort that resolves quickly after a ride, start with bike fit changes, pressure brakes, and reducing intensity. But if you have ongoing numbness, persistent testicular pain, burning, tingling, or pain that lasts after cycling, it's worth seeing a pelvic floor physiotherapist or appropriate medical provider. For most people, cycling is safe and healthy, but for some men, especially with long rides, aggressive positioning, poor saddle setup, or all of the things we just talked about, cycling can contribute to pelvic floor tension, numbness, irritation, or pain. If you found this helpful, subscribe for more evidence-based men's pelvic floor content. And remember, numbness is not normal. Pain is information and a sign that something needs to change. Thanks for watching.